Welcome to episode 5 on the IVF Success Secrets by Procare Hospital Abuja. On today's episode, we'll be looking at embryo transfer, the most critical moment. And with me today is Dr. Fache.
Good evening, Ramona. It's a great pleasure to be here.
Dr. Fache is a renowned obstetrician gynecologist based in Abuja, and he's the medical director of Procare Hospital Abuja. He is a fertility specialist and has a stellar reputation with his patients. Thank you for joining us once again, sir.
Thank you, Ramona.
Please, what is embryo transfer? And is that the final step? How important is it really?
All right. Embryo transfer as part of IVF can be seen as the critical moment of truth. Everything that has been done so far in the lab after the egg collection and the fertilization and embryo culture, this is the moment that makes the most critical part of the treatment, where anything that goes wrong with this stage can make or mar the whole process. You can liken it to the process of planting seeds. The embryo is the seed and the womb is the soil. If you plant the best quality seed in a defective soil, it will not germinate. And so it is important, it's a very critical moment, important that the endometrium now, which is the lining of the womb, has been adequately prepared to receive, to be receptive. And then timing is very crucial. Timing is very crucial as this embryo transfer needs to be transferred at the right time. So it is not, it is the last stage of the IVF process, but of course the ultimate part, ultimate last of the IVF process is the pregnancy test, which would now determine whether the treatment was successful or not. Yeah, but this is the last aspect of the procedure that is involved in IVF.
Can the skill of the doctor affect the outcome now?
Yes, like a skilled farmer and an unskilled farmer, the preparation that goes into IVF ultimately determines the success. And so skill is very important. The embryos must be transferred into a receptive endometrium within a short period of time that we call the the implantation window. So the lining must have grown to a thickness usually above 7 millimeters. And then timing is crucial, like I said, to take advantage of this implantation window, which is the short period where the endometrium is most receptive to an embryo. Transfer outside of this implantation window may result into failed treatment. And so it takes a doctor who can gently, you must also transfer this embryo in a very gentle manner so as not to irritate the lining of the womb or stimulate the uterus to begin to go into cramping or contraction. So it means that even a very steady hand is important in this process of embryo transfer. So the skill of the doctor is very important in embryo transfer.
How do you decide how many embryos to transfer?
This ultimately depends on the outcome of the treatment. How many embryos do you have in the first instance? The main aim is to mimic nature, transfer one embryo at a time. But like we've said in previous conversation, there are factors that may necessitate transferring more than one, so sometimes 2, and occasionally 3 embryos have been transferred with the aim of maximizing the chance of conception, while at the same time being cautious not to produce multiple pregnancy, which carries its own risk. So women who are younger tend to do better with few embryo transfer, one or two. People who are older, whose embryo qualities may not be that okay, can have 2 or 3 embryos transferred. People who have had repeated IVF failures, they obviously would need to have higher numbers transfer, either 2 or 3. So these are some of the determinants. The receptivity of the endometrium. If somebody has had repeated implantation failure previously, then there may be the decision to transfer 2 or 3 embryos. So, but basically, in modern IVF practice, 1, 2 embryos most of the time, then occasionally 3. There is no more is not better when it comes to embryo transfer. So there is no reason why people should transfer more than 3 embryos routinely because of the risk of, higher order multiple pregnancies that may even lead to early miscarriage or harm the mother in the end.
If I may ask, in the case where you have multiple embryos and the parents to be say we only want 1, and then now you have 2 or 3, what happens to the other embryos?
Yeah, thank you for that question. The first thing we offer to them is embryo, what we call cryopreservation. In layman's term, we say embryo freezing. So there is a technique now that these embryos can be frozen for as many years as possible. Just recently was on the media that possibly the oldest baby born, from embryos that were frozen 30 years ago, that the baby was born from. In fact, it was said that the current father of this embryo must have been a toddler, because it's like a parent who needed embryo donation. And so they had to give them this embryo from a woman who is currently 62 years, who had frozen these embryos way back then, but ended up not using the embryo. So this embryo has been donated to someone. So embryo freezing is is the first thing that we offer patients who have supernumerary or excess embryos. And where that is not acceptable, they can donate it to research. Sometimes, unfortunately, some of those embryos would have to be discarded. And so those are the fate of supernumerary embryos, basically. But most importantly, people need to know that there is advantage in cryopreserving their embryos. In fact, currently, there is a move towards frozen embryo transfer, as there more evidence is emerging that that may be more successful than a fresh transfer. Because when you do frozen embryo transfer, it takes away the effect of the hormones that you have used to helping the ovaries to produce that plenty egg in the beginning of that cycle. We talked about giving injections to help the ovaries. So as those injections are helping the ovaries to produce plenty eggs, the hormones are also having some detrimental effect on the lining of the womb. So there are strategies now we call freeze-all protocol or freeze-all strategy, where all embryos that are created, is not whether they are excess or not, are first frozen so that they can be transferred in another cycle, which will be devoid of the stimulation drugs. And more evidence is emerging that this may actually lead to more successes than a fresh transfer.
Okay, so for someone who may have a reservation, or for someone who is religious and wondering about one of the options regarding what to do with the embryo in the case where the person just wants one child, and then there's the option of discarding. If those other options that you gave are not available, how would you advise a religious person or someone who is a bit laid back regarding that discarding?
Anyway, first and foremost is adequate preparation. we at Procare Hospital, we do not start IVF treatment without discussing these possibilities first so that everybody is on the same page. So we know patients who would have those reservations, and then we'll already give them the options. We also let them know the understanding. Embryo transfer is not synonymous with pregnancy. I've heard people say they have just transferred pregnancy into me. They are phoning their husband after embryo transfer and say they've just transferred pregnancy into me. So that is not correct. And that's one of the reasons why people say, oh, just transfer on. Because for me, I feel that you need to understand the outcome of your pregnancy first before saying discard embryos. You need just one. It is the misunderstanding people have that, embryo transfer automatically leads to pregnancy. That's why when some of them will say, I just need one, discard. Otherwise, the important thing is have your baby first, and then you can decide to do what you want to do with your excess embryos. Yes.
Now, what are some of the support medications that are needed after the transfer, and for how long?
Okay, so basically, like I explained earlier, when you do IVF and you are giving that stimulation, I mentioned that there are two main injections. One is to suppress the brain, like just allow the brain to rest while you take over the body and stimulate the ovaries to produce eggs. So that brain resting may not allow the ovary to produce other hormones that are necessary, like progesterone, to support the pregnancy. And so the medication that we use for luteal support is basically progesterone. That is the one and most important medication. However, there are instances where other medications can be used. Women who have recurrent miscarriages that are thought to be related to immune problems can have steroids added to their medication. Sometimes we give low-dose aspirin, what we popularly call junior aspirin. Of course, we routinely tend to add where there's progesterone, estrogen follows. So most of our luteal medication also involve the supplementation with estrogen. So these are basically the drugs, but the one that is crucial, that is not negotiable, is progesterone, because that is what strengthens the lining of the womb to support implantation eventually. So you start it usually from the moment of egg collection in a fresh cycle, or when you start luteal medication after you have achieved good lining in the endometrium, if you are doing frozen embryo transfer, until pregnancy is confirmed. And most of the time, this is continued for 10 to 12 weeks of pregnancy before you stop them. Aim, most of the time, is to stop when the placenta is formed and then it has taken over the function of hormone production.
Thank you once again for always availing us your insights, valuable insight on this show.
It's my pleasure, Ramona. Thank you.
So today we have looked at options for would-be parents. We've looked at embryo freezing. We've looked at the need for doctors to have steady hands in the transfer. We've also looked at the medications that will be required and how long these medications are taken. For someone who is out there asking what to do, you have all these answers in this episode. Please join us for our next episode, which would be about the 2-week wait, managing the most anxious phase. Thank you for your time today. Stay with us.